The business of medicine is constantly changing. The review by Resolve discusses current contract issues for physicians, compensation trends, and tips for a successful career. Every physician's contract and career is different, and nothing in this episode should be considered legal advice. If you have specific questions about your career, please consult with an attorney. Now, on to the show.
Welcome back to the review, where we talk all things physician contracts and physician employment related. Today we have a special guest with us, Dr. Ryan Mire. Dr. Mire is in private practice and is also a former past president of the American College of Physicians. Dr. Mire, welcome on the show.
Kyle, I'm happy to be here, and thank you for having me as a guest.
You bet. Well, we're going to talk today about kind of pre-contract things of interviews, and specifically interviews with private practices, since we know that that's where you spend your days, day in and day out. So from your perspective, let's just kind of zoom out high level. What makes an interview different with a private practice as opposed to maybe a large health system or an academic center?
Sure. First of all, that's a very good question. And because those interviews do differ to some degree, there are a lot of commonalities as you think about salary and call structure, all the basics. But where it really veers is understanding that there's a lot of variability when it comes to private practice, because not all private practices are the same. And so you have to look at different models of the business structure. You have to look at different models of governance and decision making within the practice. And those things are not very clear cut until you get in and start inquiring about them. So even as it relates to salary, there are different productivity models and compensation models that exist versus more of the traditional RVU base that comes from hospitals. So there are definitely a lot of differences when you get in more depth in inquiring about the practice itself.
Sure. So let's maybe, before we get to the details maybe of the kind of the business distinction between the two, from a behavior standpoint and a communication style and things like that, what are some tips that you would have for physicians that are interested in going into private practice, that have interviews set up, with a private practice? What are some things that would be good signals, right, to you, right, as the person, the partner that's in the private practice, that they have a genuine interest in being there?
Sure. Well, that first of all, I think it starts with professionalism, right? And that's sort of the first litmus test that we can see whether an interview is virtual or in person, is just the professionalism of the candidate itself, right? Did they dress for the job? Did they dress as if they wanted the job? Once you get beyond sort of that initial assessment, the biggest thing that actually will impress a practice is how much knowledge do you have of private practice, and not so much the details of the business, but understanding that in residency, there's a lot of shift work mentality, right?
Sure.
I start at this time, I finish at this time. In private practice, no matter what specialty you go into, it's different. We stay until the work is done. There's a lot of time. There's after hours activity and charting and portal messages, things that exist beyond the typical office hours. And I think a candidate coming in with that understanding of private practice is very helpful if they show that acumen of what it's truly like versus just inquiring about more of when do I start and when do I leave each day.
Yeah. Are there certain questions that you would hope a candidate would ask if they've done their homework?
Sure, absolutely. Well, as far as the questions on sort of the model of private practice, I think understanding what is the life like outside of the office. I mean, how much work is done at home for the average person in the group?
Sure.
How late do they stay after office hours? And understanding that we don't really, an office may close at a certain time, but the business doesn't stop at a certain time. So I do think understanding those models of private practice will definitely show that they have an acumen of that approach of what they're getting into ahead of time.
Yeah. Well, let's take maybe the flip side of this coin for a second. Are there things that either in your personal experience or just in general that, physicians, and especially young physicians, right, they shouldn't do in an interview with a private practice? Things that would turn a private practice off, even if they have the strongest CV, in the world, where it might cause some red flags?
Yes, I would say, and this is from experience, having a candidate come in with, I guess, I use the word in quotes, demands on time off or their schedule from the very beginning before ever seeing a patient. And we've had that happen actually more than once in our practice, where we've interviewed candidates who came in and said, I want to be off on these days or finish my workday at this time. And that was sort of the initial assessment, which goes against sort of the private practice model in general of sort of getting the work done. And it sets a tone as if you're not ready to grow your practice and grow your business. So I would say that is a red flag number one. You may have your preferences of when you want to be off, but I would say starting off or early in the interview process, that would be a big red flag for a group in private practice.
Gotcha. Okay. Are there other subtle ways, or maybe more subtle ways outside of just demanding for schedule, that might be red flags, for you as you're interviewing them?
I wouldn't say red flags, but I will say the candidates that typically stand out are candidates that ask questions and inquire beyond sort of the basic of call schedule, of initial salary. Those candidates that really have more of a vision approach and want to know what things will be like after their guarantee year or after their first year is really what sets some candidates apart. Those who inquire about how a decision's made in the practice. Those who are inquiring about why is the group actually adding physicians? I mean, is it because they had physicians leave the practice, or is it because the growth in the area that there's a high demand? So looking at that more strategic vision and even inquiring about topics such as partnership, even though that's not the immediate goal, someone that's showing me that they want to be there long term and inquiring about what is it like or what does it take to be a partner, that shows that sort of long term vision that they want to be there for the long term. And that actually sets a lot of candidates apart versus those that are very short sighted and focusing on just that initial salary, initial call schedule, initial days off. Yeah. I would say that long term vision is very helpful.
Yeah. And I think just the nature of healthcare right now is most of the candidates that are going to be interviewing probably have, a handful of private practice options, but the majority is going to be employed, right? And so I think it is interesting of how and how you would advise them to balance that mix and to shift their questioning maybe slightly between those two. What's the best way for a physician to ask maybe some of those tougher questions, right? What does partnership look like? Can I see the practice financials? How do you guys handle decisions in governance without creating too much tension or without, feel like they're prying into the business, which they're not a part of yet?
Sure. That's a very good question. And usually in our sort of experience as physicians, we've never been in a step where we have to inquire about financial aspects of a academic center or residency program. So this is new territory for most people who are seeking their first job. And even for those who are seeking a second or third job, it's not the comfort zone to understand that business model or even inquire about it. However, it's very important. And because this is intended to be a long-term relationship, my recommendation is for the candidate to just ask up front and say, listen, I'm trying to understand more about the financial viability of this practice. Can you explain to me where you are financially? Can you share some income statements with me? Most practices should have that handy. They may not give you their entire financial package, but just understanding whether they're in the red or the black from a net income standpoint would be very important for you to understand. The last thing you would want to do is join a practice that is actually in the process of, struggling financially, because then you'll have to make another decision in 3 to 5 years to join a new group because it might not work out. So I think if it's important to you, you should ask the question, but sort of depersonalizing the question and coming from a place of curiosity is the strategy. I want to learn more, or I would like to learn more about the practice and the financial stability would be the way I would phrase those type of questions. It shows inquiry. Gotcha. And it shows inquisitiveness.
Yeah. Are there signals, and not from your practice, but just in general, that physicians should be careful of, right? That if an employer is doing X, Y, or Z, maybe that's a red flag that they're not financially healthy, or that there is some concern there. I mean, if they would deny financials, for example, they wouldn't let those out. Do you feel like that's a red flag in and of itself?
It should be a red flag. And so, like the basic financials, just say of an income statement, just deciding whether a practice is positive or negative, that is something that can be shared with the candidate. Sometimes it's not shared on the first interview, but as things progress,
Sure.
it should definitely be shared, and it should be readily accessible. I mean, a practice should know what their overall financial situation is. So if they don't have that information, that would definitely be a red flag. And sometimes just sort of looking at demand. So some practice will give you more demand on how many patients you must see in a day. And sometimes that is a red flag because they have a certain level of overhead that needs to be met. And every physician needs to make sure they're contributing to that high overhead. So the demands on you must see X amount a day if you join this practice can sometimes be a red flag because it almost shows desperation of the practice that you have to meet this for them to be financial.
Yeah. Yeah, no, that makes a lot of sense. How would you advise a candidate to maintain leverage, right? Which is what we at Resolve always want to make sure clients have is good options and that they're being treated fairly in their contracts. And at the same time, not overplay their hand and not come across as, uninterested maybe in the practice because they're referencing other offers. How would you advise them to balance that and to let practices know that they do have options without having it come across as being too arrogant or something else?
Yeah, that's a good question, and that's one that's a slippery slope. As a practice, we understand that the candidate will usually have multiple options, or we would hope they would actually, right? So
Yeah.
because if they don't, that actually lowers their leverage risk. If a candidate comes and says, this is the only practice I'm interviewing with, the only interview I've received, the only practice that I'm considering, you've already lost leverage because that's almost a sign of desperation.
Yeah.
So we actually assume as a practice and an employer that most candidates will have other interviews. So that's common knowledge. It's not a secret that you would be interviewing with other practices. I wouldn't get into the specifics of sort of matching salaries or call schedules with practices early on in that process. Even though you may have that knowledge from 1, 2, or 3 other groups, I wouldn't start that leverage very early on in the beginning until you have really decided you want to be a part of that practice and use that as negotiation techniques down the road.
Yeah. Yeah, I think that's good advice. I mean, you never want to come in and say, okay, I'm only interested in this job if it pays X, right? I mean, that's kind of a red flag for most employers because they want a good cultural fit long term. They hope you're interested in being a partner, and the money will follow that if it's a good fit, in almost every situation. So I think you're right about that. And also at the same time, if you have one place offering you a $40,000 signing bonus and the other one's offering 10, I think it's also fair to say, well, hey, there's a gap in the market and you should be aware of that, one, for your own recruitment, but two, I'd like to solve that for myself personally. So I think that's good advice. Let's talk post-interview, right? So let's say the interview goes well with a candidate and, then what happens, right? Is there silence? Is it the next step is the practice has to reach out, or do you prefer candidates reaching back out prior to that next step?
Sure, we love it when the candidate, finishes the interview, maybe process, debrief personally, whether that's, wondering whether it went well or not. If they are truly interested in the practice, and really, even if they're not, I think the common courtesy would be to at least extend a thank you to the practice for taking the time to interview them. Obviously, the more interested you are, the more your thank you should be, hey, I'm really interested in the practice. I would like to learn more. Please let me know of next steps, or when can we meet again for maybe another assessment or interview, and understanding the timeline of the practice. So the practice wants to fill the slot that they're recruiting for, and they want to do that as early as possible because it allows them to prepare. But there's a fine line in rushing the candidate versus giving them some expectations, right? So as a candidate, you don't want to drag it out for 6 months without really committing that you're going down this path, because the practice is trying to fill that slot. So I think the first step is, number one, responding to say, thank you for the opportunity to interview. I'm really interested in the practice, would love to learn more. If I have any questions, is there a way I can contact someone? Because then they can either put you with partners or the lead physicians or someone that you interviewed with. That shows that you have at least an interest to keep the conversation going.
Yeah. So in the age of all things AI and Chat GPT writing everything, Can you tell if a candidate is using their own, prose versus having a chat bot write it for them?
I think in general, because of experience and being in private practice for 23 years, being involved in interviews, there's a certain gut instinct of authenticity that
Sure.
ChatGPT just sometimes doesn't provide.
Yeah.
But I'm not in my practice. We're not in the business of fact checking or running it through a program to see if a candidate really responded to us using AI or not, because
Sure.
AI is a part of what we do. But I think when it's truly coming from the heart, it comes off a lot better than what a scripted AI response can give. So I would challenge you, if you're really interested, speak from the heart, because we can see that more in the writing and the tone of the email versus just the professional response that sometimes an AI response can derive for you.
Yeah. How many candidates generally will you be interviewing at the same time when you're, trying to fill one spot, let's say? Is it most often that you'll have 3 or 4 interested candidates, or is it really kind of a one at a time evaluation?
Well, it really just depends. And sometimes sometimes it really comes in waves. And there are periods where in private practice, because the number of physicians going into private practice has gradually decreased over the last 2 decades, there are periods of time where we may not have a large pool of candidates, but then there's other times that on average, we're talking about 3 or 4 candidates that we will be interviewing for a position. But there have been periods over my 23 years in private practice that we've only had one option. And a truly good practice that I consider myself to be a part of, sometimes we will pass on that one option if it's not the right fit, because we don't want to be desperate, because we're looking for that long-term commitment. So it's nice when we have options. It's nice when the candidate has options of other practices they're interviewing with, because we really want a candidate who truly wants to be a part of our group and not just out of desperation or because it's their only option.
Yeah.
So it goes both ways, actually.
Good. Well, then I guess in closing, this will be my last question for you today. If you could, paint the picture of maybe what I'll call the perfect private practice candidate, if they're coming directly out of training, what does that resident or fellow look like, and what would your advice to them be?
Well, I think the first, as far as that ideal candidate, to me and to many of my partners, because we share a lot of the same perspectives on this, because we've all interviewed candidates together, the most ideal candidate would be someone who is really looking for the long-term option, who can show us that they're there for the commitment and not just there for the now, right? It's your first job. Everyone will need a first job, but we don't want to just be the first job. So a candidate that can really show that long-term vision, as we talked about earlier, they're inquiring more beyond what happens in the first year, what happens with the initial salary. They are inquiring about who makes decisions in the practice, how is the governance structure, how much autonomy versus standardization does the practice have. They're looking at the culture of the group. Is it cohesive? Does it have even in private practice, does it have an academic feel where you're sitting around talking about cases sometimes at lunch, or you have the collaborative approach where you can approach one of your partners and review a case with them because you're outside of the academic setting? Those are the type of questions that lets us know that a candidate is really ready for private practice. And of course, inquiring about the business model and the business side of things, from the financials to, are there even any pending malpractice suits that may be looming over the head of the practice that could really be a determining factor? Those are the long-term visionary strategies that we look for in a candidate that would make them ideal.
Yeah.
If I had to give an advice, there are probably 2 pieces of advice that I would give every candidate. Is number 1, to make sure you're interviewing the practice just as much as they're interviewing you. And this is probably the first stage in the career of your medical profession where you're a mutual candidate, meaning you're interviewing the practice. You want to make sure it's the right fit for you and not just hopeful that someone choose you for medical school or choose you for a residency or that you match through a computer system. This is finally your opportunity to make a decision for you that is the right one, and hopefully it's for the long term. And then the second piece of advice that I would give every candidate is to make sure that if anything is important to you, you inquire about it. Because once that contract is signed, if it's not in the contract, especially for a private practice opportunity, you lose the opportunity to have that piece of importance. If that is something that's a true deal breaker, you want to make sure you discuss those things early and get those things in writing before the contract is officially signed.
Yeah, good advice. And there's still good private practice options out there, right? Even though
Absolutely.
it's a minority. Yeah.
Absolutely. Private practice opportunities that exist, they're existing for a reason because they're still surviving even the decline of private equity, and they're surviving the decline where groups are being bought out by hospital systems. And most people in private practice, one thing that they truly value is the autonomy that they have. Yeah. Not being told what to do, not having just sort of set protocols, but having decision-making power to control the destiny of the practice. So if that is something that a candidate is passionate about, private practice still remains a very lucrative opportunity for them.
Yeah, that's great. Well, I appreciate all the insights from the physician partner employer side of this. We like to make sure candidates are well informed on what the other side is thinking too. So thanks for coming on, and we'll do it again sometime.
Kyle, thank you for having me. It was a pleasure to join the podcast.
All righty. Thanks.
Thank you.
Bye-bye.